What is up, beautiful people? In case you didn't notice, I'm wearing a little bit of a different attire. That's right, I'm repping my Walla Walla University Wolves logo right here. This video is specifically for Walla Walla Nursing students. Today I'm going to be answering some questions. I did a little collab with this person, wallawalla.fresh advice on Instagram. I'll link them down in the bio. Also, you guys should follow me on Instagram, Nursing Basics. I'll link that down there as well. This video is going to be answering your questions that you guys asked, and I'm going to try to give you the best info I can about what it's like to be a nursing student at Walla Walla University. Let's do this! So the first question is, any advice for nursing students? This was the most popular question, so I'm going to go ahead and answer that for you. My first tip of advice would be to study consistently in an environment where you don't have any interruptions at all. Review what you learned the day before, even if it's just for like 10-15 minutes. That way it'll just keep it fresh in your mind and it'll help you relearn what you just reviewed the previous day. If certain topics are more difficult for you or certain subjects that you just don't understand, spend more time on those. Leave the easier stuff for later. That way you can focus on what's difficult for you. My second tip, find a good study partner. Oh my God, this makes a huge world of difference. Having a study buddy is amazing because if you don't understand something, you can bounce it off of them. Maybe they understand it, they can help you out. Also, after you guys have studied your material, you can quiz each other. Again, just like the first tip, it's important that you and your study buddy are on the same page. You don't want to have an interrupted study session because this can interfere with your comprehension and your ability to perform well on a quiz or a test. You want to perform well on a quiz or test in nursing school, because if you don't, peace! My third tip, take breaks and don't be too hard on yourself. I know nursing school is competitive. I know everyone's always talking about their grades and stuff. Just try to avoid all that. Don't talk about your grades. Don't be too hard on yourself. Don't try to memorize everything. Don't be upset if you didn't get higher than a 90% on a quiz or a test. You're gonna be fine. Just chill. The second question is, what are some places to eat near the Portland campus / how does the meal plan work? That's a good question. So I remember when I was going to the Portland campus my junior year, I was wondering the same thing. You're in Portland. There are so many places to eat. There are so many food carts, restaurants everywhere, all within like a stone's throw distance. You just gotta find a place and pick it. Near the Portland campus, I can think of over like 20 different restaurants that are within like a 10-minute drive. I mean, there's a block of food carts that's, I wanna say, half a mile away. The meal plan, this is a great question. There isn't one. The way the meal plan is set up for Portland nursing students is you have to go to the hospital. When you go to the hospital, they will give you your student badge. Then you can eat at the cafeteria there. The cafeteria there then just swipes your badge and then it charges it to your student account. You can eat there as much as you want and it's all gonna get charged straight to your student account. Make sure you figure out at what time they're serving meals because I know they have a specific window. If you're like me and like to meal prep, definitely take advantage of the kitchen. There's one kitchen in Hanson Hall. It's on the first floor. I know they had plans to remodel it sometime in the near future. I don't know what it's gonna be like next year when you get there. Also, meal prepping is fun and it saves you a ton of money. If you want a really cheap place to buy groceries, go to Winco. It's like 10 minutes from the dorm off of 102nd. It's super close and they have great produce. The third question is, what are some studying tips for nursing classes? So I kind of decided to break down the core nursing classes: pharmacology, health assessment, patho, acute, mental health, research, community, chronic, and advanced acute, and give you a little brief breakdown of what they are and how you can study for them. Pharmacology. Do not try and memorize each medication and each side effect. It's gonna take you forever and you're gonna drive yourself crazy and you're probably not gonna end up learning as much in the long run. Focus more on the classification of medications and what they all do. Like, here's an example. Certain classifications have similar side effects. We'll use beta blockers, calcium channel blockers, and ACE inhibitors. They can all affect your blood pressure. So a major side effect of all these medications would be orthostatic hypotension. Another example is antibiotics. Lots of antibiotics cause what is called photosensitivity, or you're sensitive to the light. If you walk outside with a complexion like mine, you're probably gonna get burned. Also, certain antibiotics like methicillin or vancomycin, if not taken properly or if taken for prolonged amounts of time, can lead to the development of antibiotic resistance. So yeah, just focus on the classification in general, and then obviously if there's one medication that has extremely different side effects, pay attention to those because you will be tested on those. But in general, most medications in a classification will have very similar side effects, so just keep that in mind. Health assessment. If you are not a kinesthetic learner, you better bust your ass in that skills lab. Learning your nursing skills is crucial to be able to function and succeed in the clinical setting. You don't want to be that student that doesn't get to do something like put in a catheter or an NG tube or an IV because you didn't practice it enough in skills lab. Go to skills lab. I know on main campus you need a certain amount of hours when you're doing health assessment. I believe it's 20, but don't quote me. Spread it out over each week. Do 2 to 3 hours a week. That way it won't come back to bite you in the butt at the end of the quarter when you decided to slack. Spread it out, do a little bit each week, helps you stay fresh, and do not put it off till the last minute. Pathophysiology. I'm sure everybody hears about this. It's one of the classes that I would say most widely talked about amongst nursing students because it is one of your foundation classes. Really pay attention in this class. If you pay attention and do well and study and know your material, it will make the rest of your nursing career so much easier because you'll just know stuff like that. Seriously, I cannot stress this enough. You really need to pay attention in pathophysiology and you really need to study, even if it's just for like 10-15 minutes every day. Study, study, study. It will make your life easier, I promise. That's what I did. Nursing school was a breeze. Acute! Not gonna lie, for some people this class is a bit rough. It has been known to be one of those classes that kind of weeds people out junior year on Portland campus. This is one of those classes that really tests your critical thinking. So if you can learn the bigger picture, understand the concepts and everything that's going on, this class is going to be just fine for you. This is also one of those classes that is really important that you paid attention in patho. Like I said, pay attention in patho and the concepts in acute will become much more easy to understand. Also, this class is where you will do your first rotations in the Adventist Medical Center. You will have rotations in the OR, cardiac telemetry, medical surgical, IV short stay, and cath lab. It's a pretty fun class. It's not as daunting as it seems. Just make sure you pay attention and do your best. Family! This class is freaking awesome. I really enjoyed it and I thought it was a breeze. I also somehow managed to binge watch all of Game of Thrones while I was taking this class, so I hope my teachers don't see this. The teacher for this class gives you hints for almost everything that's going to be on the quiz or test. So when she says, "Pay attention, you're gonna see this later," pay attention because you will see it later. Take a note of it, highlight it, put a star next to it, just freaking do it. Her quizzes are pretty straightforward too. However, there are people that underestimate her tests and end up bombing the midterm. Then they have to study a whole lot harder for the final and it just stresses them out a whole lot more. Don't be one of those people. Study, do your homework, you'll be fine. In this class, you will have your clinical rotations in pediatrics and labor and delivery. I believe your clinical will be at one of the following locations. You will have clinicals at Randall Children's Hospital. You could have your labor and delivery at Adventist Medical Center, Peace Health Southwest, Quality Hospital, and there's a couple of others, but I'm not sure that I remember them off the top of my head. Mental health nursing. This class is also so much fun. You'll get to learn everything, well, almost everything, about psychiatric nursing. The teacher for this class is an absolute angel. She is so sweet. She will help you with anything you need. She makes everything super easy to understand, and it's just a great class. You'll cover topics like schizophrenia, bipolar disorder, PTSD, abuse, addiction, you name it, you'll probably learn it. Nursing research. This class teaches you about the different types of research studies and what the purpose of research is. You'll learn how to identify what's a good research study, what's a bad one, and what makes them good or bad. Personally, I have to try a little bit harder in this class because it's abstract. It's not one thing leads to the other like the body systems. It's like, oh, there's this here, then that there, then that there. So yeah, for some people it's easier. For some people like myself, I had to put a little bit more effort into it. And since we're on the topic of nursing research, there was somebody that asked the question, who is the easiest and best teacher to take nursing research from? As far as I'm aware, you don't get a choice. But I will tell you this, the teachers that teach it, Lucy Kroll, she's the Dean of Nursing, she teaches it in the winter, and Karen Tate is the professor that teaches it in the spring. They're both excellent professors. I have had them both for my nursing classes. I took nursing research from Lucy. The way Lucy teaches it is she gives you a note-taking packet that has fill in the blanks and examples that you can go along with. Karen has you print out the PowerPoint slides and has you take notes on that. They are both excellent professors and you will learn the exact same thing in both classes because they use the same book and the same slides. Community! You will learn all about public health nursing. You'll also learn about topics like epidemics, pandemics, COVID-19, and all sorts of other things you didn't think you'd learn in nursing school. In this class, you can also have clinical in a variety of different settings. You could be at a poison control center, you could be at the county health office, you could could be a school nurse, and many other things. Like myself, for example, I was in a youth prison. It was a pretty interesting quarter, and I definitely learned a lot while I was there. Chronic! As you guessed it, in this class, you will probably learn about chronic diseases. There are so many of them, but I'm not even gonna bother listing them because you will learn all about them when you get to nursing school. There are also opportunities for tons of different clinical placements with this class. You can go so many different places, I honestly don't even know where to begin. This class is also crucial that you understand the bigger picture. If you're lucky like me, I had the privilege of taking this class spring quarter while I was taking the Nclex review class. Really pay attention in chronic because there is so much stuff that you learn in chronic that will be on those Kaplan questions. I remember after I took my first Kaplan, I emailed my professor Karen and said thank you because there was so much stuff that I learned on there that was extremely helpful. Pay attention because that class will have a lot of stuff that you will see on the Kaplan and the Nclex. Advanced acute. Oh, this class was my favorite. In this class, you learn critical care. ER, ICU, NICU, PICU, anything intensive, anything urgent, anything immediate. This is your class. In this class, you will learn how to run codes like a boss. You'll be able to do it with your eyes closed. Another thing with this class, there is so much information. Seriously, there is a lot of stuff going on in this class. You constantly have to be studying. There are tons of quizzes, tons of assignments. Make sure you keep up because there's always something to be doing in this class. If you fall behind, it's gonna really smack you and you're not gonna like it. While the material isn't difficult, there is a lot, so make sure you stay on top of it. The next question, should I get a job as a CNA or something else medical? Yes, it's a great idea because it can get your foot in the door and it can make nursing school easy for you. I was fortunate enough between the summers of my junior and senior years to get 2 jobs in the hospital. I was working as an imaging tech and as a CNA in the ER. Anything you can get in the medical field helps you see the bigger picture. It helps you understand things. It helps you understand how hospital flows, what you can do, what nurses do, what doctors do, how the entire interdisciplinary team works together to make sure patients live and get to go home at the end of the day. So yes, do it. I was fortunate enough to do those 2 jobs and it made my junior and senior years pretty easy. Next question, what is Portland really like for nursing students? I'm not gonna lie, Portland is freaking awesome. It's definitely not like main campus. There are way less people. For example, in the dorm, I think the max capacity of the dorm is 60, so that kind of gives you a hint. There's also a lot of people that live off campus. You'll have a much different mix of people than you do on main campus. There are lots of people that aren't SDA, they weren't raised Christian. There are lots of older people, some of them have families already. People come from all walks of life on the Portland campus. The dorm, yes, you will get your own dorm room on the Portland campus. It's pretty sweet, you can set it up however you want and you will not have to worry about disturbing your roommate. Most of the people there are pretty studious and understand that you have to do your work, otherwise you're gonna get behind and it's gonna bite you. Curfew, there is no curfew. All you have to do on the Portland campus is sign in and out. There's a check-in sheet, you just sign out when you left, what time, and then sign back in whenever you came back in. If you're leaving for longer than a day, put in a leave slip, you'll pretty much always get it approved. No, genders of the opposite sex are not allowed into each other's rooms. The way the dorm is broken up, the girls are upstairs and the guys are downstairs. There are way less guys' room than there are girls' rooms, and I think that's just because at Walla Walla there are more females that go into nursing than males. The dorm itself is pretty sweet. It's got a kitchen, it's got a lobby, there are couches in there, a couple study tables, there's a TV lounge, there's a pool table, a ping pong table, there's even a mini gym and it has its own sauna. Another cool thing, unlike main campus, you don't need worship credits. They do have Vespers every Friday, and most of the time Vespers comes with a little snack or dinner, so it's cool. There's a little free meal sometimes. There's a community every other week. It's usually on Mondays, I believe. It's been a minute. But yeah, it's usually on Mondays, and you need to go to those because if you don't, it affects your attendance for the current class you're taking and it can bring your grade down a bit. Next question. How should I approach clinical so that I can become the best nurse that I can be? I love that question, and I love to ever ask that because it shows that you actually care and want to succeed and do your best. High five. You're cool. If you go into clinical with the mindset of, I'm gonna do my best today, I'm gonna jump in wherever I can and learn so that I can be a better nurse, you're gonna kill it and not your patient. But seriously, if you go in with the mindset of, I want to learn everything that I can in clinical, you're gonna have a blast. There were so many opportunities that I got to jump into because I had that mindset. I want to learn, I want to do what I can, and I want to help out as much as possible. Your preceptor will also be more trusting of you and will give you a little bit more autonomy. That's not to say they're just gonna let you run loose, but they will trust you more and you'll develop that relationship and a good rapport with your preceptor. Don't be afraid to jump in and help out with whatever you can. If it's not within your scope of practice as a nurse or as a student nurse, at least ask if you can stand in there and watch. From my experience, the doctors that were performing procedures were super cool and were always informing me of what was going on. They love it when you ask questions because it shows that you care and are interested and want to know so that you can succeed. If you're uncertain of anything in clinical, ask your preceptor. They will help clarify what's confusing you, and most of the time this will make them happy because it shows them that you're not confident in what you need to do and they can help you out. Once they helped you out and have showed you how to do said procedure, they will be much more likely to trust you with other tasks in the hand and know that if you don't know how to do something, you will ask them and this will make them trust you more. The best thing I can tell you is to just show up to clinical with an open mind, be ready to learn, and do the best you can to care for people in need. Next question. What would you say is the most rewarding part of the experience/nursing program? I feel like this is different for everyone, but I'll tell you what was rewarding for me. Being able to learn new materials in class as well as skills and translate that into the clinical setting is awesome. It was super rewarding when I could have a conversation with doctors and nurses about what was going on with a certain patient and their condition and have a coherent, logical conversation. It's cool to know that, hey, I'm actually learning something and I know kind of what I'm talking about. Another satisfying thing for me personally was being able to care for 3 to 4 patients within a few weeks of my junior year. I felt like I was very well prepared in my classes and my professors did a great job of preparing us for clinical. Finally, the most rewarding part is knowing that you're making a positive difference in somebody's life. Yeah, you will have difficult patients, and no, not all of them will thank you for what you did, but knowing that some patients are living because of what you did is a feeling that can't be replaced. It's awesome. You should consider nursing. Next question. Where do nursing students get their stethoscopes and nursing shoes? Being honest with you, I'm pretty sure most people just buy them online somewhere. Maybe check out Amazon. Next question. What books are a waste of money and what books are good for studying? This is a great question. Personally, I only bought books for my first quarter on the main campus because I wanted to make sure that I had the appropriate resources for studying. Then I realized that everything I needed to know was on the PowerPoint slides, so I stopped buying my books. After that, I never bought a book for my junior and senior year. Books that are helpful are your pharmacology book, your nursing research book, and your nursing management book. You will use all of those, and they're extremely good resources for your junior and senior years on the Portland campus. Aside from those, you can usually get what you need from the library. The library usually has an extra copy of the book you need, and if not, the librarian there, Doug, is freaking awesome and he will help you get what you need. Aside from that, I'm gonna be honest and say I never really did any of the assigned readings, and it worked out just fine for me. What are some tips and tricks to prepare me for nursing junior year? I feel like I kind of covered this with the first question, but hit the ground running. Set aside a time for studying, really pay attention in patho, get a good study buddy, and don't slack. Also, don't be afraid to ask questions. All the professors will love to answer your questions. They're all super nice and they will help you get through this. What are some personal characteristics or reasons I should probably think twice about becoming a nurse? That's a great question, and I'm glad the person that asked this is actually thinking about it before just jumping into nursing school and figuring it out as you go along. The first thing is obviously people. If you don't like people or have a hard time getting along with people, probably not the career for you. You should probably rethink it because you're going to be dealing with people a lot. The second thing, you will have to put in a lot of effort in nursing school. If you don't want to put in the effort, please don't go into nursing school. We don't want lazy nurses taking care of us in the future, and if you're one of those lazy people, I'm sorry, I don't want you taking care of me as a nurse. Besides, if nursing doesn't work out for you, you can always be a business major. Throwing shade! I hear it's not bad. The third thing, time management. Like I said, there's a lot to do in nursing school, and if you don't have good time management skills, it might be difficult to balance everything that's going on. You will have lots of homework, you will have lots of assignments, lots of papers to type, lots of studying to do, clinicals, care plans, and balancing all of that can be kind of difficult for some people. So make sure your time management skills are on point and you'll be fine. Fourth, there are long days. A lot of your clinical rotations will be 12 hours. 12 hours can be a bit rough, especially when you have a quiz or a test to study for or a giant care plan to write up. It's not for everybody. It kind of ties in with the time management. Being able to do everything, your care plans, clinical, tests, quizzes, papers, it's a lot. Make sure you can balance your long days with your time management skills so that you can also take care of yourself. Fifth, uncertainty of what's to come. To be honest with you, in your clinicals, you never know exactly what's going to happen. In the hospital, things could be perfectly fine one second, then the next, everything goes to absolute crap. So if you're one of those people that likes to know exactly what's gonna happen next, you should maybe reconsider, because this isn't one of those fields. What would you say is the hardest part of a nursing career? This is a good one. Personally, the hardest part for me is with certain patients, knowing that you did everything possible, everything within your scope of practice, and they still did not make it. What hit me the hardest was when we had to code a 3-month-old patient in the ER. I was not prepared for it. You're never prepared for it. Myself, the nurses, the doctors, the techs, we did everything we could in that scenario and nothing worked. You have to learn to deal with raw emotions, being objective, dealing with family members, dealing with chaos. And there's a lot of things that are really hard to deal with in nursing. Yes, the more experience you have in the field, you will get used to certain things, but that doesn't make anything easy. Yeah, the hardest part is probably dealing with an extreme shift of emotions, especially when it was something that was out of your control. What are some tips and tricks for the Nclex? This is a great question, and on this channel I will be making Nclex review tip videos. Personally, what worked best for me was being completely objective. I got my setting down to the point where I could read a question and answer it in less than 30 seconds and move on. Do not doubt yourself and go with your first answer. When you're studying, don't have any distractions in the room. Set aside a portion of every day. I would usually do 5 to 6 hours straight, no distractions, power through your Q banks. After you've taken a practice test, make sure you remediate it. At Walla Walla University, you will use the Kaplan to study for your Nclex. Take notes on every question, because you will see similar questions to that in the future. Put everything on a Word doc and make a little study guide with subjects that are difficult for you, and do your best to not get distracted. That's what worked best for me. I took my Nclex, I got 60 questions, and I took it in roughly 45 minutes. So that's the best advice I can give you. Be objective, no distraction, don't doubt yourself, remediate each question, and you're gonna spank it. What are some no-brainers you think of now that were not obvious when you were in nursing school? This is also a great question. I had to think about it a little bit, but honestly, getting a job in nursing school was probably the best thing I did. It made nursing school so much easier, especially my job in the imaging department and in the ER. I got to see the patient care aspect, plus I got to see the imaging side of it. I got to combine those two things, and if I'm gonna be honest, it made my senior year of nursing school super easy. I feel like I had a pretty good grasp of the bigger picture. The only thing I hated doing was all the homework assignments and those giant research papers. Also, any experience you have is gonna make it easier for you to find a job when you graduate. The next no-brainer is try to see the bigger picture and do not focus on the small details. Like I said earlier, if you're one of those people that likes to memorize everything and know everything, great, but studying all those small little details is a huge waste of time, and most of the time you're not going to get tested on those tiny little details. It's not going to make a difference. Besides, your patients are never going to ask you in the future, what GPA did you get in nursing school? When you get into the real world, nobody cares about that. The third thing, make sure you take care of yourself both mentally and physically. Give yourself a break when you need it, get some exercise, and don't be too harsh if you didn't get the grades you wanted on a quiz or a test. There will be more quizzes and tests to come. Don't stress out too much. Do your best and just know that you did your best. Memorization is good and all, but if you can't implement critical thinking, it's going to be really hard for you to study for the Nclex. I'm not going to sugarcoat it. The Nclex questions are critical thinking, and if you can't do that, memorization isn't going to help you, and it's going to be rough. Well, there you go, peeps. That's pretty much it. If you're a sophomore and you're watching this, or if you're in the nursing program at all and you're watching this, I'm going to link down below a Google Doc that me and my classmates use that has a ton of drugs that we wrote up so that you can use them for future care plans. It's extremely helpful. Please make sure you share it with your classmates. That way all of you guys can help each other succeed. Also, when I was going through nursing school, I made Quizlets for family, acute, advanced acute, and lab values. I will also link my Quizlet down below. Again, if you're watching this and you're not a Walla Walla student, this is only for the Walla Walla University nursing program. Well, there you go, peeps. I hope this helps. Leave a comment down below. Please like and subscribe. If you need clarification on something or need some help, please let me know down below. Shoot me a message. Comment on my Instagram. Follow me on Instagram at Nursing Basics. And I hope you have an awesome day. Don't forget the basics of life. Be kind and do good. Peace out.